Good morning. This is Bert Trish from the Team Training Institute, bringing you Monday's Missing Piece. As many of you know, Monday's Missing Piece is a new little segment we're doing to help you guys and give you some condensed content that you can use at staff meetings or huddles that will help you to get your patients to accept the services that you're offering more easily. So today we're going to talk about 6 month smile and Invisalign. You know, I've been coaching now for about 2.5 years, and in the last year I can really see an increase in the um, you know, addition of some type of ortho component to most practices, and the doctors rely heavily on the hygiene department to promote these services to patients. So, I get asked all the time, Bert, how would you introduce Invisalign or 6 month smiles to patients and get them to see the benefit of those particular types of services? Well, you know, we had orthodontics in my practice where I worked for about 30 years, and so I was constantly talking to patients about the benefits of straightening teeth and moving teeth. So, what I'm hearing a lot from hygienists is that they'll bring up the subject from the cosmetic perspective, and you'll get patients who say, well, I really like my teeth the way they look. I've never really thought about ortho, or they'll tell you, you know what, I'm too old for that. I really have been fine up until now. I don't think that I'm interested in that. And then, it shuts the conversation down. The other feedback I'm getting from hygienists is that they feel like, broaching that subject from the cosmetic perspective will somehow hurt the patient's feelings or insult them, and they feel like the implication that their smile is unattractive or not pretty is a problem, so they feel very uncomfortable approaching that subject with the patient. So I'm going to share with you today a little bit about how I did this in my practice and talk to patients. And I took just a little bit different approach in how I got them to see the benefits of the ortho. Those of you who know me and have had me as a coach in your office know that I really believe in visual teaching experiences, and I'm a big proponent of using disclosing solution as an oral hygiene training tool. And as a matter of fact, that fits perfectly with how I introduced ortho to patients, because I did it as part of the oral hygiene training. If you use disclosing solution and you enable the patient to see, all the places they're missing because the teeth are malaligned or malpositioned, then it becomes quite clear to them pretty quickly that this is a big problem, and it's not about a lack of effort on their part, but more about the fact that their teeth just aren't lined up in a way that allows them to clean them, very easily. So I would always approach it from a more functional standpoint than from a cosmetic standpoint. It's quite easy to say to a patient, you know what, yeah, can you see in the mirror that if these teeth were lined up better, how much easier it would be for you to brush them clean as well as floss them or clean them. So, you want to build the value for the service and then keep it very simple. So having the mirror in their hand and letting them see that, how the teeth being straight would be, a tremendous advantage to them, really does get them to see that the ortho would be beneficial. Of course, the patient also would get the secondary added benefit of the cosmetics that goes along with doing something like 6 months Mal or Invisalign. So you want to be sure and point that out to them that no, it's not strictly because of the cosmetics. It's more of a functional issue, but certainly you would get the added benefit of having your teeth straight. So to recap, my suggestion is to, approach this while you're doing oral hygiene training with the patient. This is the perfect time to point out the teeth being malaligned, and just make sure to emphasize the point that this is not from a, because of cosmetics that we're recommending this. It's more because of functional issues that are going on, and it's in their best interest for future health of their gums and to avoid things like periodontal disease, and additional decay because of the way the teeth are positioned. That the benefit is definitely to get the teeth straightened out and moved into the proper position, and then of course they would also get that secondary benefit of a more cosmetically pleasing smile. So that's the missing piece for this Monday. Hope you guys have a wonderful day and a great week.